So we are going to discuss today kidney. Okay, we are going to discuss kidney. Smallest system, but you will get the questions from all the subjects. Okay, without wasting your time and my time, let's get started. First one is, which of the part of kidney lies in cortex and which part lies in medulla? Okay, that is anatomy and physiology question as well. Okay, in the cortex we do have something called as glomerulus, JG cell, JG apparatus, distal convoluted tubule, part of PCT. Okay, and in medulla we have loop of Henle, collecting duct, and vasa recta. How you can remember? I will give you the mnemonic. Okay, for the part which lies in medulla, this is, you can remember by the mnemonic, Madam Low CV. Okay, Madam Low CV. Rest all part is going to lie in the cortex. Okay, ये हो गया एक question. Now comes the other question. Epithelial lining in the nephron. PCT has what it has? It has cuboidal epithelial cells. Okay, cuboidal epithelial cells. Descending limb and ascending limb, that is the part of loop of Henle, will have simple squamous epithelial cell. Okay, thick ascending has simple cuboidal epithelial cell, and most of the DCD also has cuboidal cells. What you need to remember? All parts has cuboidal epithelial cell except it is simple squamous epithelial cell. If you will remember this, it is very easy. Okay, then comes the ions which get absorbed in the tubules. Remember a hint. Okay, सब कुछ रटना नहीं है. A hint. Whenever you are getting a question, which part get absorbed maximally in nephron, answer always is going to stay PCT, proximal convoluted tubule. Okay, hint याद रखो, सब कुछ रटना नहीं है. 100% absorption of which ions happen in PCT? These are bicarbonate, glucose, and amino acid. They are going to be absorbed in PCT 100%. Okay, 100%. याद रख लो, जुगाड़ ऐसे ही होता है. The most important thing that you need to remember is JG apparatus. Paper 1 questions. JG cells secretes what? They will secrete renin. They are baroreceptors. Okay, they are baroreceptor. Then comes macula densa. Question was very famous. Macula densa is a part of, it is a part of DCT. Okay, and it has chemoreceptor. Okay, mesangial cell or Lassus cell are only supporting cells. 4 point याद रखने. Secret renin. Who secretes? It is secreted by JG cell. Okay, macula densa क्या करता है? It is a part of DCT. It is a chemoreceptor. Okay, then comes hormones. Hormones में क्या याद रखना है तुम्हें? What do you think? Anyone? Table सामने है. This is the table which you see in physiology. Okay, this is the table which you see in physiology. ADH. Why do we need vasopressin? For increasing water permeability in DCT and collective tubules. Okay, then comes aldosterone. फार्मा ड्रग्स एक्ट करते हैं, राइट? यही है वो हार्मोन्स जिस पे फार्मा ड्रग्स तुम्हारे आके एक्ट करते हैं. अल्डोस्टेरॉन, व्हाट इट इंक्रीजेस? It increases serum potassium. What it will increase? सीरम पोटेशियम मतलब कहाँ? इन द ब्लड. Okay. Angiotensin will increase resorption of sodium indirectly and directly. Okay. So does water reabsorption. ANP will increase your arterial pressure. PTH, बहुत लोगों को पता नहीं होगा, PTH do acts on kidney as well. It decreases serum calcium, increases phosphorus and decreases 125 DHCC. ठीक है. This was all about your physiology. You should remember it. Now comes the most famous images. Okay, this is marked, but you are going to get unmarked. Okay, you are going to get unmarked image. Just remember, whenever you are getting a city image, look at the vertebra first. Look at the vertebra first. Okay, just near to the vertebra, just near to the vertebra is our abdominal aorta. क्या है ये? Abdominal aorta. Okay, to the left you can say right now on your screen, to the left it is, क्या है ये? What do you think? It is inferior vena cava. What is it? Inferior vena cava. To the left on your screen is actually right. Okay, to the left on your screen is actually right. So whenever you are getting image, क्या समझना है? सब कुछ उल्टा है. लीवर कहाँ है in your body? It is on the right side, right? But you are getting image when it will be on the left side. Liver, liver के अपोजिट क्या है हमारे लेफ्ट में? That is spleen, right? So ये किडनी कौन सी हुई? This is right kidney and this will be left kidney. Okay, this will be left kidney. At least इतना आना चाहिए. Okay, at least you should know this much. Okay, इतना आना चाहिए. Easy है. Just near to whatever what we have, that is abdominal aorta. Okay, to the left on your screen is your inferior vena cava, and to the left on your screen the kidney which you are seeing is actually a right kidney. So in short, what I am trying to say, everything will be opposite on the CT scan. ये आना चाहिए. This is going to come again. Okay, normal anatomical positions on the CT scan is going to be asked. अगर ध्यान था तो now tell me what is absent. Anyone? Yes, there is no right kidney. That means इसी को हम क्या बोलते हैं? Renal agenesis. This is called as renal agenesis. Now tell me, there are two types of renal agenesis: unilateral and bilateral. Do bilateral people will survive? Renal agenesis का मतलब होता है absent kidney. If both the kidneys are absent, so that child is going to survive? No, it is not going to survive. So it is incompatible. With what? Of course, with his or her life, right? But unilateral, they can survive. So they will live, right? They will live. Take a look on the X-ray. You are able to appreciate over here what we are seeing. We are seeing a kidney with calluses, right? But take a look over here. It is absent, okay? So if you are getting a urethrogram or pyelogram or kidney X-ray, absent calluses means renal agenesis. Simplest image, though people makes mistakes. ये आना चाहिए, right? We have discussed this in the last class. Try to tell what is this. Lower pole of both the kidney is fused. Okay, lower pole of both the kidneys is fused. So उसका मतलब क्या हुआ? Yes, it is horseshoe kidney. Horseshoe kidney, correct? Horse. Okay, if you are going to get a pathological slide, lower pole of kidney will be fused, right? What is the appearance which we see on the X-ray? We have discussed this. This is called as flower vase appearance. Gamla. Vase means gamla, right? Where we put flowers. That will be the appearance on the X-ray. Okay. Now tell me, horseshoe kidney is associated with which syndrome? Anyone? It is associated with Edward. See, when you don't know the answer, which syndrome is associated, remember Down syndrome. Okay. कोई भी आए क्वेश्चन, if you don't know the answer, if you want to mark it blindly, तुक्का मारना है, that is going to be Down syndrome. ठीक है. So over here also, any kind of question, if you don't know the answer is Down syndrome. Okay. Then comes Turner, correct? Turner syndrome. Okay. You can remember by the mnemonic EDTA. A for association, right? EDTA while होता है. So mnemonic is EDTA. Try to answer this question if you can. Remember, polycystic kidney disease is not associated with renal cell carcinoma. It is associated with renal stone और किडनी स्टोन. इसी को हम बोलते हैं renal lith. Okay, renal lith, that means kidney stone, right? We have discussed this in the last class. If you are going to get a CT scan, okay, you will see so many round follicles surrounding the kidney. Okay, you will see so many round follicles in the kidney. Okay, if you are going to get an X-ray, what you are going to see? An insect with the legs. insect with the legs. That is called as spider leg appearance. What we are going to see? Spider leg appearance. And if you have ever had or you went in the fancy restaurant, you would have eaten this cheese with the holes. Same over here also. Cheese with the holes. This is called as नाम भी है इसका Swiss cheese appearance. Swiss cheese appearance, right? Now we have discussed this as well. Tell me, in adult polycystic kidney disease, genes association. Just calculate the alphabet. कितने हैं? This is going to be 16. So genes कौन से associated है? 16. And one more genes you can remember by this. PCKD. How many alphabets are there? 4. So adult polycystic kidney disease is associated with chromosome number 16 and 4. Then comes autosomal recessive polycystic kidney disease. Okay, this patient is going to die in a childhood age. Childhood age में मर जाएंगे. कब मरेंगे? जब वो बच्चा है, right? बच्चा. How many alphabets are there? It is 6. So it is associated with gene 6. Okay, it is associated with gene 6. ठीक है, समझ आया? Now we come to clinical features. Only thing which is remaining to us is ultrasound of kidney. Okay, बाकी सब पूछ लिया इन्होंने. What is remaining? That is ultrasound. What you will say in ultrasound? Polycystic, right? There will be multiple cysts. So you will see so many round shaped cysts, right? Of course, they will mention ultrasound of kidney. Okay, ultrasound of kidney they will measure. What are the features? What are the features? Okay, of course it is adult polycystic kidney disease. Okay, ARPCKD patient is going to die. So features will be, they will be mostly lateral. Okay, it is going to present mostly in boys. Okay, that too in black peoples, that means Africans. Okay, there will be increase in BP. Okay, increase in BP. It is going to cause Berry's aneurysm. Okay, so there are chances of subarachnoid hemorrhage. Okay, there will be chances of subarachnoid hemorrhage. ठीक है, कैसे याद रखना है? B हो गया. Now comes C. Just remember your favorite words BC, right? They are going to have colonic diverticula. Colonic diverticula. And patient is going to die of chronic renal failure. This patient will die of chronic renal failure, right? Most common extra renal organ involved in polycystic kidney disease. Can anybody tell? Yes, it is going to be liver. And what is the treatment? Treatment for this patient? Patient is going to die of chronic renal failure. So what we need to do? We need to change it. That means renal transplant. Renal transplant. Yes, correct. What is this? Anyone? No one? This is urine. Okay. Whenever we are doing X-ray of kidney, we will insert a dye. Urethrogram इसी को बोलते हैं. This is urine. Okay. What is the deformity which you are seeing in the X-ray? First X-ray. Try to tell. Right. Whenever you are getting an X-ray of kidney, compare with other side. We are seeing normal ureter and calyces on the first side. Take a look at opposite side. We are seeing two ureter, right? We are seeing two ureter. So it is ectopic ureter. And take a look at the other X-ray. We are able to see one calyx and ureter. Over here, it is absent, right? It is absent. But if you will go down, right? If you will go down, over here, you are able to see a ureter, right? So it is also ectopic ureter. But kaha hai? It is not present at normal site. It is not present at normal site, right? Calyces भी अपनी जगह से दूसरी जगह पर है. Take a look over. These are calyces, right? So it is not ectopic ureter. Actually, it is ectopic kidney. Kidney is not present at the normal anatomical site. Okay, kidney is not present at the normal anatomical site. Okay, patient presented with hemoptysis, chest pain, fever. Okay, and there is pain in abdomen. X-ray of abdomen is done, and CT scan is also done. Again, should I repeat? Patient is presented with hemoptysis, chest pain, fever for more than 6 months, and there is pain in abdomen as well. X-ray of abdomen is done, CT scan of abdomen is done, and we are seeing the image. What is the probable diagnosis? If I will write down the name, everybody will answer this. This is called as putty kidney or cemented kidney. ये भी तो पढ़ाया था मैंने. TB. TB. This is called as thimble bladder. Whenever you are getting question on hemoptysis. Okay, whenever you are getting question on hemoptysis in India, it is going to be TB. So 99% of the time question is on TB as soon as you will see hemoptysis. Okay. And there will be one sure shot question from nephritic and nephrotic syndrome. Okay, either they will ask you the classification or they are going to ask the disease. Okay, we are going to discuss this in detail. Now tell me, nephritic syndrome, itic, okay, and nephrotic, confusion यही हो जाता है. What is itic and otic? Okay, in nephritic syndrome, what is going to happen? Proteinuria will be how much? कितना होता है? Less than 3.5, yes, gram per deciliter. Okay, gram per deciliter. How we define hematuria? What is the definition of hematuria? Anyone? Urinarium करते हैं, right? Urinarium, right? So in the microscope, how many RBCs should be there? Yes, it should be more than 3 RBC. In how? कैसे? एक में मिल गया, that means it is a hematuria in one sample. Urinarium, urine random microscopy, right? In 3 samples. कब? In year, in month, in a week, what? Over 1 week. This is the definition of hematuria. एक sample में ही मिल रहा है, that means it is not a hematuria. Okay, make it clear. Oliguria. What is the meaning of oliguria? Easiest one, you have read it, but I know that you forgot it. Simple definition also comes, and these questions are not going to come in your recall videos. Okay, easy questions बाहर नहीं आते, and hardest one as well, बीच वाले आते हैं. Yes, less than 400 ml per 24 hour. That is called as oliguria. What is the meaning of azotemia? Increase in blood urea nitrogen. Right? Increase in blood urea nitrogen. How it is going to decrease the urine output in nephritic syndrome? Anyone? Remember, hypertension क्यों हो रहा है इस पेशेंट को? RAS system, right? Renin angiotensin uptake, right? RAS system is going to get activated. Okay, it's going to get activated. That's why there is decrease in glomerular filtration rate. That's why we are going to have hypertension as well as oliguria. Okay, this is the nephritic syndrome. Then comes nephrotic syndrome. There is going to be protein leak. Protein leak किसमें मिलेगा? In nephrotic syndrome, proteinuria for more than 3.5 gram per deciliter. Lipiduria, lipid will be also lost. Okay, edema, we will get swelling on the body. Okay, on the kidney as well. Albumin is decreased, that is called as hypoalbuminemia. Okay, cholesterol is increased, is called as dyslipidemia. right? Coagulation is increased. You can remember this by the mnemonic protein. Sounds similar like a K, right? Just remember nephrotic syndrome features. Opposite will be nephritic syndrome. Okay. Protein किस में लीक हो रहा है? More than 3.5 gram, right? Lipiduria, edema. Okay. इतना याद रख लो. These are the features of nephritic and nephrotic. Nephrotic के याद रख लो. Opposite will be nephritic syndrome. Right? Sure. Then comes the classification. Easiest question when it comes in the exam hall, right? Nephritic syndrome contains which diseases, and nephrotic syndrome contains which diseases? Anyone? Yes, examiner's favorite. You should know it, right? Yes, PSGN, right? PSGN. Then comes antibody against glomerular basement membrane. That is called as good pasture syndrome, right? Alport syndrome, right? RPGN, rapidly progressing glomerulonephritis. And last one is your IgA nephropathy. Can we remember by the mnemonic PARI? Okay. Nephrotic syndrome content was which one? Minimal change disease. Yes. Membranous glomerulonephritis. Yes. Focal segmental glomerulosclerosis. Right? And remember this, nephritic and nephrotic both can be seen in which one? It is SLE. Okay, SLE can cause nephritic as well as nephrotic syndrome. उसी को हम बोलते हैं SLE nephritis. And MPGN. Okay, they can cause both. Okay, they can cause both. This is the classification that you should know. At least remember the mnemonic परी हूं मैं, राइट है ना? परी को क्या होगा? नेफ्रेटिक सिंड्रोम. ठीक है, वी विल डिस्कस वन बाय वन. फिक्स टॉपिक है किडनी में. द ओनली सिस्टम वेयर यू आर गोइंग टू गेट फिक्स्ड क्वेश्चन. यहाँ चेंज नहीं मिलेगा आपको. ठीक है, सो ये आना चाहिए. एग्जामिनर्स फेवरेट. ट्राई टू आंसर. Question is finished over here. Child, right? And biggest hint, subepithelial humps. Okay, whenever you are going to get question on related to kidney and they are giving the history of throat infection or skin infection, answer is always going to stay PSGN, post streptococcus glomerulonephritis. That's it. Okay, post streptococcus glomerulonephritis याद ही रखना है, स्किन एंड थ्रोट इन्फेक्शन, even don't need to think, answer is going to be always PSGN. ओके, चलो क्या क्या होता है PSGN में? एज ग्रुप क्या है? What is the age group? Just we have read 15 month, that means in the child, so age group will be children. Organism involved is group A, beta hemolyticus, right? हिस्ट्री कहाँ कौन सी मिलेगी? जस्ट वी हैव डिस्कस दिस वन एज वेल, हिस्ट्री ऑफ स्किन और थ्रोट इन्फेक्शन, ENT में पढ़ा होगा थ्रोट इन्फेक्शन कौन कॉज करता है, सो दैट इज कनेक्टेड ओवर हियर एज वेल, राइट? हाइपर सेंसिटिविटी कौन सी है? विच इज द हाइपर सेंसिटिविटी? यस, it is type 3 hypersensitivity. Okay, no, it is type 3. Antibody associated, we have seen one over here, right? GBM गुड पास्चर में मिलती है, इसमें नहीं. Okay, it is ASO, anti-DNase, and one more, जिसने अच्छे से पढ़ा है उसके लिए और एक है, नहीं पता, एंटी hyaluronidase antibody. Okay, anti hyaluronidase antibody, which is the most specific from these three? Most specific. This is the most specific, that is anti-DNase. Okay, anti-DNase. Confusion होता है और ये होगा पेपर में. Treatment, what is the treatment for this? Anyone? Remember, it is self-limiting. Okay, right? Reassurance. If we need to give, then we can give antibiotics plus or minus steroids. Okay, plus or minus steroids. Now tell me what you are going to see on electron microscope and on immunofluorescence. This is called as subendothelial deposits. Okay, and also outpouching on subendothelial lines. It is called as hump. Hump का मतलब होता है डिपॉजिट करना. Okay, subepithelial humps. Subepithelial hump. On immunofluorescent, what we are going to see? Anyone? है ना, आजा ले चले तुझे तारों के शहर में, है ना, खाने को पैसा नहीं लेकिन तारों के शहर में जाते हो गानों में, राइट? दिस इज योर तारों का शहर. ओके, दिस इज कॉल्ड एज स्टारी स्काई अपीयरेंस. Starry sky appearance, right? And if we'll take out that kidney, and what is the name given by the pathologist? If we'll take out this kidney and take a look, it look like someone has eaten this, bite कर गया ऐसा लग रहा है ना. कोई आके इसको खा गया थोड़ा थोड़ा, है ना. दिस इज कॉल्ड एज फ्ली. बटन नहीं, बिटन. फ्ली बिटन किडनी. करेक्ट. ओके. इट लुक्स लाइक द फ्ली हैज ईटन द किडनी. इसी को बोलते हैं हम फ्ली बिटन किडनी. The answer is going to be lungs. Okay. How you will remember? G stand for Gurda. Gurda means kidney. And P stand for Pepda. Pepda means lung. If Gurda and Pepda, that means kidney and lung is involved, is called as क्या बोलेंगे सो? It is called as good posture syndrome. Okay. Questions कैसे आएगा? That means you are going to get clinical features from the kidney as well as the clinical features from lung, right? Which antibody we do see over here? Someone has answered this before. That is anti-glomerular basement membrane antibodies. Okay, anti-GBM, right? What are the clinical features? See, trick hai. Okay, there are two diseases which sound similar. PSGM, what we are getting? We are getting URTI. Okay, rhinitis, sinusitis, and sore throat infection. But what is the clinical feature of LRTI? Lower respiratory tract infection, right? Lower respiratory tract infection is going to present with hemoptysis. Is going to present with hemoptysis. Kidney में क्या मिलेगा? डिसीज का नाम क्या है? नेफ्रेटिक सिंड्रोम, right? So we are going to get hematuria as a clinical feature, right? Hematuria as a clinical feature. So in the kidney, what we will get? Hematuria. We will get hematuria, right? This is the clinical features of good posture syndrome. Okay, क्या हुए? Hemoptysis plus nephrotic syndrome feature. That means hematuria is good posture syndrome, but there is a trick. If examiners add hemoptysis, hematuria plus URTI features, इसका मतलब क्या हुआ? अपर रेस्पिरेटरी ट्रैक्ट इन्फेक्शन. कौन से होते हैं? साइनोसाइटिस और इसी को हम बोलते हैं राइनाइटिस. ओके, इन शॉर्ट नोज के और थ्रोट की इन्फेक्शन इसमें ऐड कर दे विथ फीचर्स ऑफ LRTI एंड हेमेचुरिया. आंसर इज चेंज्ड. क्या बोल रहा हूं मैं? आंसर इज चेंज. Answer will no longer be good posture syndrome. Answer is going to be Wegener's. Granulomatosis. Understood? समझ आया? Tricky है. Exam is never going to be easy until unless you understand everything. LRTI plus hematuria. Answer is good posture syndrome. LRTI, हेमेचुरिया प्लस साइनोसाइटिस, राइट? उसका मतलब क्या है? नाक बहना. आंसर इज वेगनर्स ग्रैनुलोमाटोसिस. Okay, answer changed. Now tell me, in good posture syndrome, which RPGN happens? Yes, someone is trying to impress me. Yes, it is RPGN 1. Rapidly progressing glomerulonephritis type 1. And in type 1, what you will see? You will see this is called as linear deposition. क्या बोलेंगे हम इसे? Yes, linear deposition. So what we are going to see? You are going to see linear deposition. Okay. In type 2 rapidly progressing glomerulonephritis, what we are going to see? This is called as granular deposition. क्या बोलेंगे हम इसे? Where do we see? We will see in type 2 RPGN. Okay. Now comes grade 3 or type 3 RPGN. We are not going to see any kind of deposition. That is called as no deposition. Okay. How the 3 questions come? Take a look. Yes, correct. First question, linear IgG or C3 deposition, right? हमने अभी देखा this one is going to be seen in type 1 RPGN, right? Correct. So इसका आंसर क्या हुआ? If such question comes directly, the answer will be RPGN type 1, right? RPGN type 1. Second में देखो granular deposits. इसमें था linear. Now we have this one, right? So it is called as RPGN type 2, right? RPGN type 2, correct? And as I said, in type 3 RPGN, what we are going to see? We are going to see, right? So it is called as okay, type 3 RPGN. ठीक है, आ गया समझ में? No deposition. Now tell me, type 3 RPGN में is associated with which one? Yes, बताओ. आ रहा है तुम्हें? You know this one. We have seen the associated syndromes with type 2 as well as type 1, but yes, correct. Remember, RPGN 3 is associated with ANKA. They are ANKA positive, right? So there are two types of ANKA. One is Priyanka, right? And one is Sianka. Sianka, right? Yes, correct. So Priyanka is associated with what? Microscopic polyarteritis. And Sianka is associated with Wegener's granulomatosis. It is associated with Wegener's granulomatosis, right? Now take a look over here. What we are seeing, a some kind of nodule, right? A some kind of nodules. If you will do the electron microscopy, what we are going to see, a some kind of nodule. Okay, no deposit, but हमें कैसे याद रखना है? We are going to see a big nodule in type 3 RPGN. Okay, in short, Wegener's granulomatosis में नाम क्या है इसका? Granule, right? So we are going to see a big nodule. Okay, we are going to see big nodules. इसी को बोलते हैं हम no deposits. We are not able to appreciate the image. जैसे हम दूसरे में मिल रहे थे हमें, right? We are not going to appreciate the image over here, right? समझ आया इतना? Understood? ये questions आएंगे, believe me. What is this? Kiminstein Wilson nodule. क्या होता है इसके अंदर? Just I changed the name. Actual name is Kiminstein Wilson nodule, right? What I did, I changed it Kiminstein Wilson lesion. Nodule उसके नाम में है, right? The name itself contain a nodule, so answer will be nodular sclerosis of glomeruli, right? Nodular sclerosis of glomeruli. This is the answer, right? And it looks like this. There will be multiple nodules, okay, surrounded in one glomeruli. Surrounded in one glomeruli. Confusion नहीं होना है. Take a look over here. It look like a big one nodule. Okay, it look like a big one nodule. But in nodular sclerosis, we are going to see the nodules are taking the shape of glomeruli. Okay, nodules are taking the shape of glomeruli. आया समझ? चल, try to answer this. Hematuria with proteinuria, that means it is nephritic syndrome, anterior lenticonus and sensory neural hearing loss. Even if you are not able to recall remaining, if you know this, the answer is pretty much clear. High in outer port, क्या बोलेंगे हमसे? High in outer port is called as L port. High in outer ports, I coming out, right? Ports उसका बढ़ गया आगे. Hearing loss gone, sensory neural hearing loss. The answer is going to stay Alport syndrome. And which appearance we see in this? That is basket wave appearance. What we see? We see basket wave appearance. Okay. Which type of collagen is defective over here? Anyone? Again, it is called as type 4 collagen defect. Okay. टाइप 4 कोलेजन डिफेक्ट। फिर से ड्रॉ करूं, ओके समझ आ गया, टाइप 4 कोलेजन डिफेक्ट। सो व्हाट वी आर गोइंग टू सी, we are going to see anterior lenticonus, right? Outpouching of eye, kind of, right? Sensory neural hearing loss, right? Type 4 collagen defect, okay, that is present in lens, cochlea and kidney, okay? Cochlea and kidney क्या मिलता है हमें? Nephritic syndrome, proteinuria plus hematuria, right? What we are going to give? We are going to give ACE inhibitors. A stand for Alport, A stand for ACE inhibitors, right? Okay. And what we are going to see on electron microscopy, that is basket wave appearance. है ना, बास्केट जैसा दिख रहा है, ओके, बास्केट वेव, इसको हिला रहे हैं, वी आर जस्ट उसको शेक कर रहे हैं, दैट इज कॉल्ड एज बास्केट वेव अपीयरेंस। अंडरस्टूड दिस मच? आता है, इजी है, anybody can give this question. It can come from pathology, it can come from ENT, it can come from ophtha, it can come from medicine, it can come from pedia. So Alport syndrome is important syndrome, okay, आना चाहिए। Then comes membranous glomerulonephritis, membranous glomerulonephritis, okay, इसे कैसे याद रखोगे? Just remember, it is most common cause of, what it causes, nephritic or nephrotic? Anyone? नेफ्रिटिक सिंड्रोम कॉज करता है नेफ्रोटिक? Yes, it is going to cause nephrotic syndrome. In whom? In whom? Old age. Yes, elderly. SLE. HIV. Sorry, not HIV. It is hepatitis. And cancer. In short, all the old peoples. Adult में, when you don't know the answer from nephrotic syndrome, answer is membranous glomerulonephritis. Okay. In rat, what do we call it? MGN को क्या बोलते हैं? In mouse, physiology question. Hayman nephritis, इसी को हम बोलेंगे Hayman nephritis. Okay. Now, whenever you are going to get question on MGN or any kind of nephrotic syndrome, they are going to write down two things. That is, one is electron microscope, right, and light microscope. So in electron microscope, what do we get? Anyone? Loss of foot process, and one more, spike and dome appearance. So whenever you are going to get question, catch this line: spike and dome appearance plus old age. Answer is MGN, right? MGN. Take a look over here. It look like spikes, right? It look like spike appearance, right? So this is called as spike and dome appearance. Okay, spike and dome appearance. And if you take a look over here, the podocytes has lost its foot from the base. This podocytes is going to lose their bases. इसी को बोलते हैं loss of foot process. Loss of foot process. Okay. Image is not going to come in color. Image will be black and white. The image is of electron microscope. Okay. Electron microscope. ठीक है. What we have seen in membranoglomerulus nephritis, we saw two things. One was loss of foot process plus spike and dome appearance था उसके अंदर, right? Spike and dome appearance. Okay. But if you are seeing only effacement of foot process, or इसी को हम बोलते हैं loss of foot process, the lighter version of MGN is called as MCD. ठीक है. Lighter version of MGN is called as MCD. Okay. So first hint is age, and second hint will be effacement of foot of process. इसी को बोलते हैं loss of foot process, and it is going to be seen in MCD, minimal change disease. It is most common cause of nephrotic syndrome, in whom the lighter version of old, right, will be children, right? Same. So in short, what we are having, MGN in adult, that is the bigger version, right? Lighter version will be present in our light peoples, that is children's, right? Light microscopy on IM and on electron microscope, this will be normal. On electron microscopy, what we are going to see, loss of foot process. What we are going to see, loss of foot process, right? So what you can get in the question, either they will write down just loss of foot process, or they can write down on light microscopy or indirect microscopy. What we are seeing, we are going to see nothing. Okay, we are going to see nothing. That means it is normal. Okay, it is normal. Treatment for MCD, treatment क्या होती है इसकी? It is steroids. No reassurance. We need to give steroids. Okay. And remember, MGN hint है exam में. Okay. Poor response to steroids. This line can also come. Nephrotic syndrome with poor response to steroids. Which one? And the answer will be MGN. ठीक है, MGN. Focal segmental glomerulosclerosis. Which type has worst prognosis? The answer is going to be collapsing. Collapsing किसमें मिलता है? It is going to be seen in HIV, right? Cocaine abuser, right? And heroin. Okay. Electron microscope पे क्या मिलेगा? Name itself speaks actually. focal segmental glomerulosclerosis. So on electron microscopy, what we are going to see? नाम में ही लिखा है, yes, we are going to see sclerosis. Okay, और इसी को बोलते हैं हाइलिनोसिस. Okay, हाइलिन डिपोजिशन. Okay, ये हो गए थे हमारे नेफ्रेटिक एंड नेफ्रोटिक सिंड्रोम. इंपॉर्टेंट टॉपिक, गोइंग टू कम फॉर श्योर, फॉर श्योर. ओके, कोई अगर मुझे पूछेगा पेपर में क्या आएगा, this is the topic that is going to come for sure. Okay, even whatever I am not teaching, you need to read it. Question will be there. Now that was the syndromes. Now if you remember, we put or divide this patient into two categories. One is AKI, acute kidney injury, and second one is CKD. Right, medicine में पढ़ते हो तुम AKI and CKD, chronic kidney disease and acute kidney injury. Now AKI is classified by which category? Simplest question which comes in exam. By KidCo. What? By KidCo. Okay. And second classification which we use is rifle classification. Okay. Now over here, at least try to remember, if you can, at least remember the name of the classification. First thing, easiest one. Over here, at least try to remember AKI third stage. Okay, AKI third stage. You need to remember anuria for more than 12 hours. Right? Anuria for more than 12 hours plus create. Okay, create more than 4. Whenever you are going to get questions, they are going to give everything, but at least itna to catch kar longe uske andar. That is create more than 4 and anuria for a day or a night, right? With create more than 4, it is going to be category number 3, right? When you some of you might have a patient of kidney failure. Okay, ये लिखा होता है ESRD, end stage renal disease. Okay, end stage renal disease लिखा होता है. कहाँ से आ रहा है वो? राइफल क्लासिफिकेशन से आ रहा है. Okay, no urine at all. This patient need dialysis in end stage renal disease, right? So that patient will be transferred into which category? CKD patients. Okay, CKD में भी याद रखना है, when you get a CKD patient, most of the time, okay, what I'm saying, most of the time as a doctor, तुम में जो लिखेंगे पेपर पे लिखते हैं, राइट? डॉक्टर्स राइट डाउन ऑन द पेपर stages. So most of the time CKD patient with grade 4 and 5 is written down. Okay, first, second, third or third B is going to managed on medical management. Okay, medical management. Reason being, we can give diuretics so patient can have urine output, right? I will write down the name of the tablet as well so you can remember this tablet. Very famous name is tablet dieter. Okay, tablet dieter company का नाम है, but still you should know it. Actually it is Lasix furosemide. Okay, reason, to have a output from the kidney. But grade 4 or grade 5 we cannot use it. patient needs dialysis. Okay, patient needs dialysis. Just remember the boundary line, less than 30 glomerular filtration rate. Okay, less than 30, patient need dialysis. And definitive management for these patients, if the uh, level of glomerular filtration is going down less than 30, so kitna definitive management is always going to be kidney transplant. Okay, this patient will present to you thrice a week dialysis, right? हफ्ते में 3 बार डायलिसिस इसको लगेगा. Okay, because there will be no urine output. 3 बार डायलिसिस अगर इंडिया में करना है, that means you need 1 lakh rupees. Okay, simple logic. So we need to transplant the kidney, and kidney transplantation is also not easy. So please take care of your kidney, or else you will lose the life as well, and you will lose the money for the family as well. Okay, CKD patient very hard to live. Even if you will transplant the kidney, we don't know how much time that kidney will take time to survive. कितने दिन वो किडनी भी रह चलेंगी ये भी नहीं पता होता. Okay, how we do dialysis? There are 2 types of dialysis. Okay, there are 2 types of dialysis. One is hemodialysis. Okay, you would have seen a patient is attached to a machine, right? Patient is attached to machine, right? And second one is called as peritoneal dialysis. It is called as peritoneal dialysis. Okay, we do have dialysis catheter, right, which we will insert in the veins, right? Bigger. I have shown you this image in anesthesia class, right? And to not put the catheter, what we will do, we will make arteriovenous fistula. Arteriovenous fistula, right? Most common site for arteriovenous fistula is, anyone? Left radiocephalic. Okay, left radiocephalic. Peritoneal dialysis क्यों नहीं कराया जाता? Okay, peritoneal dialysis can be done at home. Okay, can be done at home. Patient को hospital आने की जरूरत नहीं है. What is the disadvantage of this? Anyone? Infection. Infection is the most dangerous complication, right? Patient is of kidney and you are going to cause him infection. So patient can present with AKI as well, CKD with acute kidney injuries as well, right? And second complication is potassium will be less removed. Okay, potassium will be less removed. Okay. Most common complication of hemodialysis. What do you think? We are going to dialyze the blood, right? We will remove the create potassium from the blood, and blood is going to come out of your hand or from your veins and artery. Is going to go in the machine, and from the machine it is again going to come inside. So what will be the complication? Most common complication will be, anyone? Most common complication is hypotension. Clot formation is not the complication because machine does contain heparin. Okay, there are two types of dialysis: heparin free dialysis and with the heparin. So clots are less likely to form. Okay, दोनों होते हैं उसके अंदर, heparin free dialysis and with heparin dialysis. So clot is less likely to be a cause. Okay, hypotension होगा, reason is blood is coming out of the body, right? Though we will add NS in the dialysis machine, normal saline भी add करेंगे, still patient can have hypotension, and this is the complication which will lead that patient to stay in the ICU. Okay, hypothermia, yes, we can have. Now tell me about kidney transplant. How many HLAs do we need to match, and which is the ideal donor or best donor? Anyone? How many HLAs should match? A, B, C, D, P, D, Q, and D, R. D, P, D, Q, D, R. That means total how many HLAs should match? It is 6. Okay, it is not 3. It is 6. And best donor कौन सा है? Anyone? आ चुका है पेपर? मजाक नहीं हो रहा है यहाँ पे. Remember, it is your brother. Okay, it is your brother. वाइफ की किडनी लेंगे. वाइफ की वजह से तो खराब होती, दारू पीता ना उसके बाद आदमी. सो नो, इट इज योर ब्लड ब्रदर. ठीक है, नॉट वाइफ. Then comes the caste, right? Then comes the caste. See, normal or in dehydration we will see highly in caste, which will be more like a transparent caste. Okay, transparent caste. Waxy caste will be seen in end stage renal disease, that is ESRD, right? Waxy. Proteinuria में क्या हो रहा है? Protein is leaked, right? So we will see fatty caste. ठीक है, take a look over here. Granules. Okay, there are so many granules, so it will be seen in acute tubular necrosis, ATN. Okay, it will be seen in acute tubular necrosis. देख लेना इसको, आना चाहिए. चलते आगे. इजी इमेज क्या करेंगे? इंपॉर्टेंट टॉपिक. डायरिया में कौन सा एनायन गैप मिलता है? एनीवन? It is normal anion gap. What is the value of a normal anion gap? It will be 8 to 14. If it is standing in this range, it is called as normal anion gap. Okay. You can remember, sorry, increased anion gap by the mnemonic sir made pulao. Okay, though I will not made for you. Okay, remember this, sir made pulao. And in this also you should know 2-3 things. Okay, it is starvation. Okay, not dehydration. Starvation means khana nahi khana. Dehydration means not drinking the water, right? Difference. Okay, diarrhea will cause what? Normal anion gap, right? Diarrhea will lead to dehydration. So diarrhea, this you should know at least. इतना आना जरूरी है. Acidosis हुआ है, again water will go down, right? Yes, yes, yes. One-liners which comes in tuberous sclerosis, what we are going to see, that is angiomyolipoma. Angiomyolipoma. What do we see in tuberous sclerosis? We will see periungual fibroma. Okay, periungual fibroma यहाँ मिलता है, right? Periungual fibroma. And on the back, we are going to see ash lip macules with angiofibroma on the chin or cheek. Tuberous sclerosis, derma में पढ़ेंगे आएंगे तब. Now just remember it very fast. What do you think? Renal cell carcinoma. How many alphabets are there? 3. Most common type of carcinoma is renal cell carcinoma. Types कौन सी? That is clear cell carcinoma. Right? Again, answer will be 3. Chromosome number 3. Which gene is mutated? The gene which has 3 alphabets. VHL gene. Right? So everything will be 3 in renal cell carcinoma. Okay? RCC, clear cell carcinoma, CCC, right? And VHL gene is mutated. So everything will be 3, right? Everything will be 3. Right? Most common type कौन सी है? It is clear cell carcinoma. Okay, malignant, right? Yes, CCC. चलो. Examiner's favorite image. Anybody? क्या है इसे क्या बोलते हैं हम? No one? This is called as Samoma body. Samoma body. Okay. In what we see the Samoma body, anyone? There are so many diseases. At least you should know renal cell carcinoma. Okay. Then comes meningioma or ovarian, salivary, and thyroid. These 3, कौन सा subtype? That is papillary cancer. Okay. At least try to remember this papillary cancers. Okay. You can remember by the mnemonic, right? All of you tends to read in night, right? So the most important time of the night of the day is night, right? So raat most. Okay, raat most is the mnemonic. And which type of calcification is seen in Samoma body? Anyone? It is dystrophic calcification. So what is getting deposited? It is calcium, right? It is getting calcium. Then we come to Wilms tumor. Wilms tumor. Wilms tumor में क्या होता है? Gene number? Anyone? Okay, chromosome or gene number, chromosome number. No one. Remember it like this. Wilms cancer. Wilms cancer. How many alphabets are there? It is 11. Okay, so chromosome number 11, right? Chromosome number 11. Alphabets are 11, so answer will be 11. Wilms tumor is associated with what? It is associated with Weger syndrome, right? इट इज एसोसिएटेड विथ वैगर सिंड्रोम। क्या क्या होता है वैगर में? विम्स ट्यूमर, aniridia. G stand for what? What do you think? Genital anomaly. And R stand for what? Retardation. That means mental retardation. And this is your Wagner syndrome. Okay, Wilms tumor, aniridia, genital anomaly, and retardation. Okay, and there are two more syndrome. Okay, two more syndrome: Beck with Wiedemann syndrome and Dennis-Drash syndrome. Okay, Beck with Wiedemann syndrome and Dennis-Drash syndrome. You would have seen this in your OBG class and in patho class. Beck with Wiedemann syndrome. Okay, I will give you a hint. Use this. Okay, nothing personal. If you will have weed, okay, if you will have weed, hemihypertrophy means hypertrophy, increase in size. So this patient will have large penis. Okay, hypertrophy of penis. If you are going to smoke weed, what happens? You are going to have sexual arousal, so size will increase. So weed will increase the size. That is called as hemihypertrophy. Okay. And second one, Dennis Drash. Remember it like this: Dennis ka chota. Okay, Dennis ka chota. Okay, the reason: gonadal dysgenesis. The size of gonads will be less, right? So Dennis ka chota, and if you will have weight, size will increase. ठीक है, this is the hint. ऐसे याद रखना होता है, ऐसे पकड़ना होता है एग्जाम में भी। सब कुछ रटना नहीं है, बोल के थक चुका हूँ ये चीज। बायलैटरल एजेनेसिस ऑफ किडनी क्वेश्चन आता है। बायलैटरल एजेनेसिस ऑफ किडनी इज सीन इन व्हिच डिसीजेस? वन फ्रॉम गायनेक, एनीवन? Amnion nodosum will have bilateral agenesis of kidney, and second one is Potter's syndrome. Okay, Potter's syndrome. So Potter syndrome can be remembered by the mnemonic, which is written in front of you. I will not waste the time. Pulmonary hypoplasia, oligohydramnios, twisted limbs, twisted skin, right? Skin पे fold होंगी, and renal agenesis. This question has been asked already. Okay, this question has been asked already. आना चाहिए. फीचर्स लिखे हैं ना, सो उसका मतलब क्या है? इफ इट वाज अ डेड, तो फीचर्स नहीं होते ना, राइट? इट इज नॉट डेड. यस, इट विल डाई, बट इट इज नॉट डेड. समझे? चलो, एज आई सेड, नेफ्रेटिक एंड नेफ्रोटिक सिंड्रोम पे क्वेश्चन आता है, दैट विल गोइंग टू कम फ्रॉम पीडिया और फ्रॉम मेडिसिन. देन कम्स कार्सिनोमा पैथो एंड स्टोन्स फ्रॉम द सर्जरी. फिक्स टॉपिक है, आना जरूरी है. ट्रांजिशनल सेल कार्सिनोमा, मोस्ट कॉमन रिस्क फैक्टर, एनीवन? Most common is smoking. Okay, even this question has been asked from PSM perspective as well. पूरा याद रखना है इसको. एनिलीन डाई, और क्या कॉज कराता है? बेंजीडीन. Yes, in short, just remember it like this. All the kind of dyes, okay? Naphthalene or dye industry, and one more industry, that is textile industry, right? Because they are going to use dyes, right? They are going to use dyes, right? Rubber industry, one more. रबर किस में यूज होगा? टायर इंडस्ट्री, ओके. एंड microbiology question: transitional cell carcinoma of bladder is going to be caused by which organism? Anyone? No one? Cystosomia, आगे का तो बता दो. Hematobium, okay. Cystosomia hematobium will cause transitional cell carcinoma of bladder. Treatment? Anyone? This is the treatment. इसको बोलते हैं टर्प. Okay, we will put a probe and we will cut that part, that is called as TERP. Okay, radical cystectomy. प्लस क्या देंगे? प्लस क्या देंगे? Very famous anti-cancer therapy. The name of therapy is MVAC. MVAC देंगे. So M stand for methotrexate. V stand for vinblastine. Okay. याद रखना, confusion will be over here. It is blast. Okay, it is not vincristine. Examiner is going to give, they will make the mnemonic themselves. It is vinblastine, not vincristine. Okay. Adriamycin. And C stand for your favorite drug, that is cisplatin. Okay, cisplatin. This is the MVAC. Then we come to kidney stone. Kidney stones, last topic. Most common stone is calcium oxalate. Okay, they are divided into dihydrate and monohydrate, correct? And monohydrate, right? Monohydrate stones will look like what? Take a look over here. Okay, they will look like this, something like this, right? Over here also. This is called as dumbbell shaped. और इसी को क्या बोलते हैं हम? One more name is there, hourglass, है ना? जिसमें वो रेत भरी होती है और हम उसको उल्टा करते हैं, राइट? दैट सेम ग्लास, है ना? कुछ इस तरह होता है, hourglass shape. ठीक है. And take a look over here. It look like envelope. Envelope होता है. It look like envelope. So dihydrate will look like envelope shape on what? Urine areum. Okay, but if you will take this out, ये fruit खाया होगा तुमने, right? In foreign, that is called as mulberry appearance. Okay, fruit का नाम क्या है? Mulberry. Okay, now tell me, calcium oxalate stones are radiolucent or radio-opaque? Anyone? ये तो आना ही चाहिए सर्जरी से. Okay, stones आने ही चाहिए. रिमेंबर रेडियो ओपेक, क्या है? रेडियो ओपेक. ओके, एवरी स्टोन हैज अ स्टोरी. सो सबकी होती है. व्हाट इज दिस स्टोन? Okay, you came from the foreign country, so you would have seen a coffin, right? So it is coffin lid shape. ये ऊपर वाली, it is called as coffin lid shape, right? Coffin lid shape कैसे बनती है? Which stone? Yes, it is triple phosphate stone. So how many ions should be there? इसी का नाम है स्ट्रोवाइट और ब्रूशाइट. Yes, so how many ions should be there? 3. कौन से होते हैं? कैल्शियम, मैग्नीशियम एंड वन मोर. कौन सा होता है? दैट इज अमोनियम फॉस्फेट. 3 है ना? सो बना किससे होगा? 3 से, राइट? द कैलकुलस विच वी सी इज कॉल्ड एज कैलिक्स का शेप ले लेंगे ये. दिस विल टेक द शेप ऑफ होल कैलिक्स. ओके, इट विल टेक द शेप ऑफ होल कैलिक्स. सो इट इज कॉल्ड एज स्टैगहॉर्न calculus. Which organism is associated with triple stone? Microbe. It is Proteus. और कौन सा ऑप्शन में नहीं है Proteus? Then it is Klebsiella, right? In short, what we have, these organisms can be seen in alkaline urine. Okay, urine is going to be alkaline. Okay, because of ammonium phosphate. Okay, both organism can cause Staghorn calculus. Then comes uric acid stone. कौन सा बोल रहे हैं? uric acid stone. Okay, uric acid stone. क्या बोलते हैं इसको? Take a look. It looks like the transparent दिख रहा है पूरा. इसी को हम बोलते हैं ग्लास ना. ग्लास्ड shards का मतलब होता है टुकड़े. Okay, it looks like a 1 2 3 4 5 6 ग्लास के टुकड़े. It is called as glass shard. ग्लास के टुकड़े. Okay, कहाँ मिलता है? Uric acid stone will be seen in the diseases which increases uric acid. Logic, right? Uric acid stone will be seen in diseases which increases uric acid. कौन से होंगे? फेवरेट ये तो पता है सब, राइट? देयर इज वन मोर, ट्यूमर लाइसिस सिंड्रोम. यस, करेक्ट. और कौन सा होता है? लैश निहान सिंड्रोम, राइट? हाइपर यूरेसीमिया जिस भी डिसीज में मिलेगा, दे आर ऑल गोइंग टू कॉज यूरिक एसिड स्टोन, राइट? नाउ टेल मी व्हाट विल बी द ट्रीटमेंट फॉर दिस? मेडिकल मैनेजमेंट क्या होंगे? पेशेंट इज गोइंग टू हैव acidic urine, right? So what we can do? We can make urine alkaline. How we can make urine alkaline? गाउट में देते क्या है? आलू एंड पूरी, राइट? आलू एंड पूरी, that is allopurinol. and acetazolamide. Okay, acetazolamide. So these drugs make urine alkaline. Okay, now tell me ये कौन सा है, रेडियो ओपेक और रेडियोलूसेंट? ट्रिपल फॉस्फेट कौन सा है? रेडियो ओपेक. कंफ्यूजन क्यों है? when you don't know the answer in kidney stone, it is always going to be radio opaque. ठीक है, but uric acid stones are radiolucent. ये याद रखना जरूरी है. yes, rest all are radio opaque except uric acid stones. कंफ्यूज नहीं होना है. ओके, कंफ्यूज नहीं होना है. कैसे लिख रहे हैं? कितने एंगल है? 1 2 3 4 5 6. 1 2 3 4 5 6 एंगल. इसी को हम बोलते हैं हेक्सागोनल. राइट, हेक्सागोनल शेप stones are seen in what? Cystinuria. It is seen in cystinuria, right? And remember, this is the hardest stone. This is the hardest stone. ठीक है, ब्रेक करना मुश्किल हो जाएगा इसे. अगेन रेडियो ओपेक और रेडियोलूसेंट अभी बताया मैंने. all are radio opaque except uric acid stone. So this will also be radio opaque. शेप समझ नहीं आ रहा, राइट? इसको बोलते हैं इंडिनावीर स्टोन. व्हाट वी विल कॉल इट? इंडिनावीर stone. Okay, remember over here investigation of choice is not x-ray, it is NCCT head. NCCT. Okay, NCCT abdomen. Okay, क्या फीचर्स होते हैं? व्हाट इज द फीचर्स ऑफ अ स्टोन्स? क्लिनिकल फीचर्स क्या होते हैं? वन लाइनर से यार. पहला फीचर क्या होगा? रीनल कोलिक, पेन इन द फ्लैंक्स, right? Right flanks, left flanks, because kidneys are in the back, right? So pain will be flank pain, right? उसी को बोलते हैं renal pain, renal colic. What do we give when patient is with renal colic? Drug or drug of choice, you can say. Pain associated with renal stone. The answer is always going to stay Voveron, right? Voveron सुना है? That means diclofenac. Okay, diclofenac we will give. ठीक है? Yes, hematuria. और क्या होगा? Patient will have urge for urination again and again, right? So उसी को बोलते हैं increase in frequency of urine, right? urge आएगा उसे बार बार यूरिन करने का, right? So urine frequency will be increased. Just I said, investigation of choice over here is NCCT, right? Reason, it contains contrast. The stone has contrast enhancement. Okay, contrast इसमें बढ़ेगा. So that's why we will be able to see on it NCCT. But normally हर एक में नहीं करेंगे CT scan, right? It causes money to government or to people as well in the private hospitals. So what we will do, investigation of choice without specifying anything, it is going to be X-ray, किडनी, यूरेटर, ब्लैडर, इसको बोलते हैं एक्सरे केयूबी. Okay, kidney, ureter, bladder. Okay, but in pregnancy we cannot use it. Okay, because what do we have in pelvic region in pregnancy? We have a child, and we cannot expose this child to X-ray beam. So investigation of choice in pregnancy is going to be either MRI, but it is not going to be done. Okay, first investigation in pregnancy is going to be ultrasound. All has been asked in a different format, even giving as a case scenario. ठीक है, आना चाहिए. It looks like one liners, but they are not one liners, believe me. Okay, then comes management. When we will give tamsulosin? Anyone? When we will give tamsulosin in renal colic management, in renal stone. BPH की बात नहीं कर रहा मैं यहाँ पे. अल्फा 1 इनहिबिटर्स होता है. That is called as spontaneous expulsion of kidney stone. कब करेंगे? When patient's kidney stone is less than 5 mm, not causing infection. Okay, no increase in TLC count, right? Not in solitary kidney and not causing obstruction of any kind. Huh? You would have seen so many people say that beer पीना चाहिए. Actually beer यहाँ पीनी चाहिए, पीनी भी हो तो. Okay, beer से कुछ नहीं होता. That is called as spontaneous expulsion. Okay, done by using tamsulosin. But this patient do not come to the hospitals. Okay, but this question can come into your exam. Now comes ESWL. ESWL, right? बीम लगा के स्टोन को तोड़ना. ओके, बीम लगा के स्टोन को तोड़ना. हाउ मच? यस, 20 mm का मतलब क्या हुआ? 2 सेंटीमीटर. बट वेयर? इन अपर एंड मिडल व्हाट? कैलिक्स. ठीक है, अपर एंड मिडल में आ गया 6 to 20, तो तुमने जो लिखा है. बट अब इससे भी छोटा हो सकता है, राइट? लेस देन 1 सेंटीमीटर, दैट मीन्स लेस देन 10 mm in where? In lower calyx. कॉन्ट्राइंडिकेशन क्या है इसके? फर्स्ट, we cannot expose beam on a child, right? So patient is pregnant, right? Patient is pregnant. So contraindication, first one is pregnancy, right? Yes. Second will be infection, that is UTI. In UTI we will not do it. Second thing, we are going to expose patient to the radiation, right? If patient is taking something or it has something inside which is going to give radiations somewhere, that is called as pacemaker. स्पेस मेकर है और तुम उस पर फ्रीक्वेंसी, हाई फ्रीक्वेंसी की रेडिएशंस भेज रहे हो, इट कैन ब्लास्ट, राइट? बैटरी होती है उसके अंदर, राइट? सो इन दिस कंडीशन वी विल नॉट यूज. यस, हार्ड स्टोन्स, हार्ड स्टोन्स कौन सा होता है? सिस्टीन, राइट? सिस्टीन होता है. एंड देयर इज वन मोर, triple phosphate, that is brushite and monohydride stone. In this stone we cannot use ESWL. ठीक है. पेशेंट का स्पाइन इज डिफेक्टिव, कौन सा होता है? फॉर एग्जाम्पल, स्पाइन इंस्टेड ऑफ गोइंग स्ट्रेट इट वाज कर्व्ड, सो स्कोलियोसिस. और इसी को बोलते हैं हम काइफोस्कोलियोसिस. काइफोस्कोलियोसिस, राइट? लास्ट, patient is having bleeding. In this we cannot use ESWL. Okay, ESWL cannot be used. What are the complications of ESWL? Okay, patient was treated with ESWL, now presented with this. आ चुका है recent one, now presented with this. Stone street, इसको बोलते हैं the stone which was present in kidney, we broke it by using radio frequency, but now ब्रोक किया है, मिट्टी बनाई है. Now this मिट्टी is coming in the ureter. इसी को बोलते हैं हम स्टोन स्ट्रीट. क्या बोलेंगे हम इसे? इट इज कॉल्ड एज स्टोन स्ट्रीट. Stone street. Now you know the fancy name. What is the fancy name? Stain straws. Stain straws. This is the complication. और क्या क्या हो सकता है complications? Okay. Stone बहुत बड़ा था. You have given the radio frequency continuously. Now patient is having bleeding. और क्या हो सकता है? Pain. And that bleeding got stored in the kidney itself. Bleeding नीचे नहीं आई, यूरेटर से बाहर नहीं आ रही, हेमेचूरिया नहीं हो रहा है. That bleeding got stored in the kidney itself. इसी को बोलते हैं हम renal hematoma. क्या बोलेंगे हम इसे? renal hematoma, right? You remove the stone and there are some cell injury to the kidney. Now patient is presenting with urinary tract infection. So these are the some complications which we will see with ESW. ठीक है. Now PCN, percutaneous nephrolithotomy. Just remember PCN. All the complications of ESWL will be the indication of what? PCNL. 5 minutes more, we are done almost. क्या बोला मैंने PCN का? All the complications of ESWL will be the indication of what? PCN, right? Any kind of stone, what I'm saying, any kind of stone which is more than 2 centimeter. Okay, right? Contraindication में क्या था? Hardest stone. This one also be removed by that one also, right? Lower calyx में कितना remove कर पा रहे? Only 1 centimeter. So lower calyces stone which is more than 1 centimeter will be also removed, right? So lower calyx stone, right? Patient is having obstruction, suppose यहाँ पर है और यहाँ, that is called as distal obstruction of kidney. Okay, so any stone which is actually going to impact on the ureter will also be removed by PCN. Okay, percutaneous nephrolithotomy. In short, we are going to insert a probe, right? Okay, distal obstruction. Then comes hard stones. Patient is with UTI. Patient is with UTI. These are the indication for PCNL. Most common complication will be, what do you think? We are going to insert a probe from a skin which is going to go inside the kidney. So what we can have as a most common complication, of course, bleeding. It is going to stay as a bleeding. Question will change. Most common complication through 11th rib approach. What do you think? 11th rib. Hydropneumothorax. Okay. Most common organ injured in PCNL. It is pleura. If pleura is not in the option, then you can go for colon or spleen. Colon or spleen. Last line, you will finish this. There is something called as sandwich technique. सैंडविच टेक्निक, उसका मतलब क्या है? बोथ PCNL and ESWL will be done together. क्या करेंगे हम इसमें? PCNL and ESWL both will be done. For which calculus? Sandwich technique will be used for which calculus? That's it. Last question from the kidney. Anyone? Yes, correct. The answer is Staghorn calculus. Okay. With this, we finish kidney around exact 2 hours. It is the most important system in your exam. Okay. In your exam, this is the most important system. Read this along with your notes. Okay, from surgery plus medicine. Okay, kidney के questions fix है, not going to change. What you need to do, ये पढ़ लो 1 घंटे में and try to solve the questions. If some point are missing, add in this and make it more perfect. Of course, I cannot take everything in 2 hours, right? I try to give you the broadest concept which is needed, right? And one more thing, try to sleep early as soon as you can. Okay, as soon as you can, and make a habit of waking up in the morning. Reason being, this is the last month, and in the last month, if you are not going to wake up early, it is going to cost you in the exam, and for sure it is going to cost you in exam. Okay, so please try to sleep early as soon as you can. Even if you are sleeping at the 10, that is also okay, but wake up soon. Okay, make a habit of waking up in the morning, right? So with this, we will finish the session, right? And which session you want to take me, do let me know in the next class. That is going to be tomorrow. Chalo, with this, we will end the session, right? Okay. Chalo, good night to all.